what qualifications or training do you need to have to be able to use and apply ACT? The answer to that question is twofold. The first part is, what qualifications do you need to have? The answer to that is actually none. There is no requirement that you need to have any qualification whatsoever to be able to apply ACT and the 6 core processes. What we often go out and ask is that people have a fundamental understanding of counselling or social work or occupational therapy, psychology and the like, because that's the basis around therapeutic work with clients from a psychological perspective. The second part of the question is, what training do you need to have to be able to apply ACT? Training is a question around what is it that you feel comfortable in doing in a manner that is clinically appropriate and of value to your clients. I imagine if you're anything like I am, before you go out and call yourself an ACT therapist or a CBT therapist or a Schema therapist, you want to have a level of experience to go out and say that. But like any model, you probably need to start at the beginning. So we all start off as beginning ACT therapists. We go out and we try a few different techniques and strategies, and it starts off being fairly clunky and a little bit sort of rusty, but the more we practice it and the more we understand, the better that those tools and understandings get. And so when it comes to the training, I would really encourage everyone out there to go out and, in particular, go to workshops, introductory workshops, advanced workshops, workshops for adolescents, workshops for adults, looking at workshops specific to anxiety or depression and the like that are based around the ACT model. And certainly complement that with readings, whether they be journal articles or books, or even discussions and supervision with your peers around ACT to really try and get an understanding. So you don't actually need any qualifications, but it's really helpful to go out and get lots of training under your belt. But you've also got to remember, at some point, you need to go out and do a little bit of committed action in the service of your values to start doing ACT. It gets clunky. My apologies, certainly is clunky at the beginning. I certainly was as a novice and starting out, but with more and more practice, you'll get better and better. So continue your professional development, your professional learning, and continue to develop, keep asking questions, and you'll get there. So train, and do it respectfully with your clients. Call yourself an ACT therapist after reasonable training, and that way you can feel comfortable not only within yourself but also in providing that for your clients.